We will now recognize Senator Allen Dr. Bates.
Thank you, Mr. President. House Bill 3650 comes to the Senate of the House of Representatives with a 59-to-1 vote. Colleagues, the cost of our present health care system is not sustainable. We presently spend twice as much per capita as any other country in the world for health care, are now ranked 49th amongst the industrialized nations in life expectancy and #1 in cost. While this bill only relates to Medicaid, the transformation of that health care delivery system and the cost savings projected as a result could lead to reform of the entire system. Oregon is uniquely positioned to deal with the high cost of health care, in particular Medicaid. We have in place now community-driven, prepaid managed care organizations that account for 85% of the patients enrolled in Medicaid. While we see this as a norm here in Oregon, most states are still mired in a system dependent on a fee-for-service with little or no management and no cost savings. In addition, the principles of House Bill 3650 are already being piloted in groundbreaking projects such as those established in Linn-Benton counties and in Deschutes counties, where the silos between mental health, drug and alcohol, dental and physical health are being broken down with significant savings being realized and improved outcomes. House Bill 3650 establishes the Oregon Integrated and Coordinated Health Care Delivery System and begins the process of replacing prepaid managed care organizations. The bill allows for the creation of coordinated care organizations which will be locally accountable for achieving better health outcomes and cost savings in the Oregon Health Plan. This focus on local improved care and savings will be achieved through coordination and integration of the entire continuum of care. That is to say, physical health, mental health, dental health, alcohol and drug treatment, and home health care for the elderly. This integration of care is one of the two centerpieces of the legislation. The other is global budgeting. Global budgeting is a payment system in which a total amount of dollars is paid to a CCO for the delivery, management, access, and quality of health care delivered to the members of the CCO. This reform will allow Oregon to escape the constantly increasing and unsustainable cost of the fee-for-service delivery system, which rewards increased utilization rather than improved health. The Oregon Health Authority will report back to the legislature no later than January 1st, 2012. The authority will report back on the criteria established for CCOs, a business plan, the global budgeting process, a medical malpractice and liability study, and a contract dispute process. Through transformation, the Oregon Health Plan will focus on local control and efficient use of available health care dollars. Community-based local integration is the primary lever we can use to drive down costs and make use of the resources available in the most effective and efficient manner. In Oregon, with this legislation, we are choosing to avoid cost shift to commercial insurance by maintaining our present systems while we plan for a future that allows us to produce better health at lower cost. Colleagues, to do nothing, to just say no and hope and expect our present health care system to somehow fix itself or put more money into the system is no longer a viable option. As we have looked at budgets this session, we have too often made cuts without addressing the underlying issues driving those increased costs. This legislation does just that. It directly addresses the underlying cost drivers in our health care delivery system and puts forward a viable blueprint for the future. House Bill 3650 is a bipartisan bill. It is landmark health care legislation. Countless hours of work with stakeholders, the public, the governor and his office, and the legislature have produced this consensus bill. This has been the work of many hands. I would particularly like to thank Representative Kotek, Representative Freeman, along with Senator Cruz and Senator Morse for the final amendments to this bill and their ongoing commitment to the process over these many months. The foundational work done by the Joint Special Committee in the House and Senate Policy Committees has proven indispensable. I cannot thank Representative Thompson, Representative Greenlick, and Senator Mons-Annister and Senator Shields enough for all their late hours and hard work. Finally, I would also like to thank all the personnel and professional staff who have spent many months coordinating all these many intricate details. Colleagues, this is truly a dramatic reform which will lead to significant savings, better outcomes, and better health for Oregonians. I strongly urge your aye vote. Thank you.